Hi, I'm Chris Jackman, nurse practitioner of functional medicine, and I'm here to talk a little bit about the differences between holistic medicine versus natural medicine, and kind of what my job as a functional medicine provider is to find the kind of best of both worlds because there's a big divide in people thinking that either need to follow the holistic or natural route or and stay away from pharmaceuticals, or the people who are like, oh no, you have to do Western medicine and the pharmaceuticals because that's where the data is. But there is a middle ground, and sometimes you can use kind of the best of both worlds to get you to feel your best. And that's my job, is to kind of bring the best of both worlds and give you options and seeing what your body does best, and what your body needs to thrive and feel its most optimal self. So thyroid is a good example of where you can kind of have different options. If you're hypothyroid and your thyroid is underactive, maybe your body needs things like iodine or selenium. Maybe your body needs things like zinc. Maybe it's a methylation process problem. Maybe you can use a glandular supplement, which is a natural hormone that is extracted from an animal's thyroid and put into a supplement. And these can work to optimize your thyroid in some people. Some people do need to go the synthetic route or the prescription route and use things like Synthroid or levothyroxine or liothyronine or Cytomel, which is T4 or T3. Some people may want to use a natural prescription like NP Thyroid or Armor, which are glandular prescription medications. So, depending on what your labs look like, depending on what your symptoms are, depending on how quickly you want to feel better, all these are on the table and are options, and you need to know which one you can utilize. On the other side, you have hyperthyroid, where your thyroid is overactive and you may have your hair falling out or headaches or heart palpitations, thyroid eye disease, things like that. And you can use things like L-carnitine, which is a amino acid supplement that kind of calms the thyroid down, and you may not need medications. You may need medications because it is very severe, and in that case, you may need methimazole or PTU, which are prescription medications to quickly get the thyroid levels balanced. And then maybe you can transition to something like L-carnitine. Maybe you have too much iodine in your body and you need to get it out of your system. And maybe you're getting iodine in supplements or foods that you need to cut out, or selenium. Lots and lots of options. So make sure that you talk to somebody who knows what they're talking about and get you on the right path to feel your best.